Okay, so we're live at Spokane Regional Health District, and we're talking with our health officer, Dr. Bob Lutz. Obviously, we know that we're dealing with some extreme heat and also battling poor air quality. And so we'll ask a couple questions of you, and we'll invite our viewers to ask additional questions. And here we go.
Great.
Okay. So specific to the extreme heat, what are your concerns given that today and tomorrow's temperatures are expected to be in the mid hundreds?
Yeah, I'd say the big problem is that people are not used to being in temperatures this high. If you live in Tucson, yes. If you live in Spokane, no. So people are going to have problems with heat illness. People with other conditions such as diabetes, such as heart disease, lung disease, obesity, are going to have health problems that are going to be made worse or stressed on their system.
Okay. So what should people be doing to stay safe?
Yeah, I mean, the biggest thing by far and away is A, stay well hydrated, and B, avoid the heat as much as you can. So what does that mean? It means finding air conditioning if you can. If you don't, use room fans, cool the air off, close the blinds, really try to darken the house and keep cool as much as you can.
Okay. Can you explain a little bit for viewers the difference between heat stroke and heat exhaustion?
Yeah, I think there's a misunderstanding. I think a lot of people, when they have heat illness, think they have heat stroke. Heat stroke is a medical emergency. And the way we differentiate it is that with heat exhaustion, you feel puny. You know, you get nauseous, you get a little lightheaded, you just don't feel well. You may have muscle cramps. With heat stroke, you have all that and worse. I mean, all of a sudden, 2 + 2 is 6. And you're not quite sure what day it is, and you're confused. That's heat stroke, and that's a medical emergency. It requires you to be seen very, very quickly and cool the body temperature way down, get it back down to normal.
Okay. So switching over to poor air quality, what are your concerns about residents and their health and this air quality?
You know, I think there's a lot of overlap, you know, unfortunately, with the heat. With poor air quality, again, we have vulnerable populations. We know the kids, we know the elderly, we know the people with respiratory illnesses, with heart disease. It's going to stress their system. Poor air quality, especially from wildfire smoke, is really hard on the body, and it can cause a lot of inflammation, which can, again, make underlying medical problems worse. So, again, like I said about heat, same thing with air quality. Get out of it. You know, get inside, avoid being outdoors if you don't need to be. You know, I think it really is inherent that when you have high heat and poor air quality, people need to really reconsider what they're doing as their normal day. You know, so it's really spending more time indoors, really changing the types of activities that you're doing or not doing.
Okay. Are face masks the answer?
No face masks. I mean, you know, I will not tell people not to wear a face mask, because it can provide some benefit. But the ones that you buy at the hardware store, they're great for sawdust, not so great for the small dust that's coming out of fires. So, and my concern is that it gives people a false sense of security. It will help a little bit, but it's not going to help a whole lot. So again, I think the best thing that you can do is, if you don't need to be outdoors, then don't be outdoors. Really try to stay in air-conditioned or well-ventilated places, and stay out of the heat, stay out of the poor air quality.
Okay. And lastly, we've got some new guidance specific to outdoor events and what the community needs to know for organizing events. And so maybe talk a little bit about that, as well as the guidance we offer for air quality.
Yeah, I think, you know, for general information, I strongly encourage people to check out our website, where again, we've posted a lot of information, also working with partners like Clean Air, Spokane Clean Air, where you can monitor the air quality, which is a great piece of data to have for you. You know, again, we tell people that when it's extreme heat like we're dealing with right now, plenty of fluids. If you're outdoors, make sure you're clothed properly in light, cool clothing, and lots of hydration. Likewise, if you're outdoors for bad air quality, consider being indoors. Consider changing what you're doing and where you're doing it.
Okay. All right. That's all we have for today on extreme heat and air quality. Thanks, Dr. Lutz.
Yeah, let's hope it gets better.